Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome back to my YouTube channel. I am Dr. Dada, and I'm back today with the topic under women's health. As you all know, today is our part 3 of women's health, and today the topic is going to be vaginal discharge. It's a very interesting topic, and it's a very important topic because so many women think that if she has a vaginal discharge, it means she's having infection or some kind of weird something coming out. Okay, in normal circumstances, like the vaginal discharge is a normal fluid which is created from the glands in the vagina and then from the glands in the cervix, which is the lower part of the uterus. And this discharge carries away the dead cells, the microorganisms, all out of the body. So it's a kind of cleaning mechanism for the woman, for her genitals. Okay, and in some circumstances this discharge can be abnormal. This is when, for example, she has an infection. Yeah, it's abnormal. And then in some situations, this discharges increases in amount. For example, when she is ovulating, it increases in amount, and when she is breastfeeding, also increase in amount, and also when she is sexually aroused, this discharges increases in amount. Okay, and then we have different kind of discharges depending on her menstrual cycle, her monthly menstrual cycle. For example, during ovulation, this discharge increases, and it becomes thicker in consistency, and then like it starts from the beginning of the ovulation week. It becomes thicker and thicker until the day of the ovulation, which becomes more thicker, and it's as it goes towards the end of the ovulation week, it becomes as usual, normal. It goes back to its normal consistency. Okay, now what are the causes of this abnormal vaginal discharge? Some of the causes of abnormal vaginal discharge are things like infection, which is the most popular one, infection. And then we have drugs like the antibiotics, the steroids, the birth control pills. Also, they are also causing abnormal vaginal discharges. And we have things like the PID, pelvic inflammatory disease, and we have sexually transmitted diseases, which are the STDs, and we have patients who have diabetes also, and we have patients who have cervical cancer. It also increases their discharge, and it's abnormal kind of a discharge. Okay, now we have different kind of discharge ranging from normal to abnormal. Some of the discharges, some are white, some are green, some are yellow, and in the consistency, some are thick, some are thin, and some are cheesy like, and some has false smelling. Okay, now what are the abnormal vaginal discharge and what are normal vaginal discharge? The normal vaginal discharges, we have like when the discharge is white, just white, is usually normal, except if you find that it's accompanied with itching. White and itchy is abnormal. And we have another one which is white and clear. You understand? So this one is also perfectly normal, and it increases when you exercise. And then we have which is thick and clear. You understand me? Thick and clear. This one also is normal and usually happens during the time of your ovulation. And we have the brown discharge, which is also normal, and it happens before or after your menstruation, which is also very, very normal, except if it happens in somewhere around the month, which is not before or after you, immediately before or after your menstruation. And then there is the bloody discharge, which is also abnormal except your menstrual cycle. Understand? And sometimes during your ovulation you have also the bloody discharge, which is not very much. Yeah, when it is too much and it's not your menstruation, you need a consult. Now, what are the abnormal discharge? We have one which is white and cheesy material. It just looks like cheese. It's abnormal. And the greenish, the yellow, the brown, the bloody, or any other discharge except the ones I just mentioned and the normal discharges, and the time is abnormal. You understand? But majority of the time it's a normal discharge. So now, what are the symptoms of this abnormal discharge? If you have noticed you are having, or you think you are having an abnormal discharge alone, then you can look for other symptoms. For example, you might be having itchy. It might be itchy down there, and you can be having pelvic pain, which the pelvic pain is not related to your menstruation. And also you have your urination will increase and in frequency, okay? And then you will have fever and then the discharge. Okay, so now how do we investigate patients with this kind of problem? Take a very good history and examination in the hospital, and they give you a swab test and related tests according to your type of discharge and according to differentials. Okay, and then the treatment is according to cause. Okay, now this brings us to the end of vaginal discharge. I hope you all grab something in this video. Thank you all. Kindly like, share, subscribe, and leave your comment or suggestion. Thank you very much. Bye bye.